lots of other people are trying to see who stands when you stand. Anyway, 6 o'clock.
Order. I call Irene Campbell to move the motion.
I beg to move that this House has considered E-petition 742-179 relating to NHS breast screening. It is a pleasure to serve under your chairmanship, Mr Vickers. I would like to start by thanking the petitioner Gemma Reeves for all the hard work she has put into starting this petition and gathering over 106,000 signatures from all across the UK. The petition is titled "Lower the age for invites to regular mammograms to 40 and perform annually," and goes on to say, lower the age for when women are first called to 40 and provide funding to carry out mammograms annually instead of every 3 years. Early detection is key and the prevalence of breast cancer in young patients is rising. I am a chemotherapy nurse and working in this clinical setting for 8 years, and I have seen the rise in breast cancer in patients under the age of 40 increase. Early detection is key in identifying those aggressive forms of breast cancer. So I know that this is an issue which many people here and outside the chamber care deeply about. Breast cancer still affects too many women, and far too many women die from breast cancer every year. I had the privilege to meet with Gemma, who is here today. She told me about her experience of being a nurse for 15 years, 8 of which have been in oncology, and about her concerns in seeing a rise in breast cancer cases in younger women, especially since COVID. Breast cancer is the most common type of cancer for women in the UK, and 1 in 7 women may get breast cancer. As Gemma wrote in her petition, early detection is key and has led to improved recovery and survival rates. Over half of breast cancer cases occur in women who are outside the national screening age, and 1 in 6 are in women under 50. Men too get breast cancer, however this makes up approximately 1% of all cases. Currently, the NHS invites women to come to their first breast screening when they are between the age of 50 and 53, and this goes on until they are aged 71. They are invited every 3 years, after which a woman can choose to continue going for mammograms, but are not automatically invited. While everyone is at risk of breast cancer, women are at a higher risk if they are over 50, have dense breast tissue, have a family history of breast or ovarian cancer, or have particular breast conditions, for example, benign breast disease. There is a breast screening pathway for those who are identified as NHS targeted very high risk. It is also important to note that NICE guidelines recommend annual mammography scans for women who are aged between 40 and 49 at moderate risk, as well as annual mammography or MRI surveillance for some high-risk groups. I will give way.
Can I commend Honourable Lady for bringing this forward? And there's 66 women every year that are diagnosed with this cancer, unfortunately, each year. Does the invasive lobular breast cancer, of course, accounts for some 15% of all breast cancer cases, routinely missed until it reaches an advanced stage. Hundreds of members of this House have backed the call for a dedicated £20 million 5-year research investment into the fundamental biology of lobular cancers. Does the Honourable Lady agree that the Minister, and I believe she's sympathetic to this, must undertake incorporate advanced screening technologies such as a contrast-enhanced mammography or MRI into the NH pathway for women with dense breast tissue or suspected lobular profile? Government must grasp the issue and must do something now.
I thank the Honourable Member for his intervention, and I too look forward to hearing the Minister's response on this issue. So 1.94 million women between the ages of 50 and 70 were screened in 24-25, and almost 20,000 cancers were detected. Cancers were detected in 9 in every 1,000 women, which is a 16% increase on the previous year. Attendance to screening reached the highest level in a decade, championed by charities like Breast Cancer Now, who shared public figures' stories and personal messages.
Thank you, and I thank you for the intervention and for securing this important debate. On the matter of screening, I wonder if you share my concern, or the member shares my concern, between the difference with first-time attendees to screening and returning attendees to screening. The numbers are, I think, 89.1% and 63% respectively. So I wonder if she has a view on how we can approve those attending their first screening.
Thank the Honourable Member for his intervention. Screening is key, obviously, to this, and I think we have to be more, perhaps, bold and inventive about how we get people along to screening. There have been many public health campaigns over the years, and when a campaign is undertaken, there is always a rise in attendance, and then when the campaign stops, it falls again. So I agree that is something that we must, and the Minister must then look at in relation to this.
Would the member take another intervention?
I will.
Thank you, Mr Vickers. The member makes a very, very valid point, and I wonder if she's aware that in Scotland in 2020 to 23, more than 3 in 4 women took up their screening invitations. But there is unfortunately a clear difference between take-up based on deprivation. 64.2% of women in the most deprived areas attended, compared to 82.8% in the least deprived areas. And breast cancer survival rates reflect that very much, because women from more deprived areas in particular are more likely to die at an earlier age because they haven't been for screening and they're diagnosed late. The point about having innovative ways of making screening available to people is important, but so too is screening in their neighbourhoods. I wonder if the member agrees.
I thank my honourable friend for her intervention, and I fully agree with what she said. It is unfortunately the case that people, it's not just for breast screening, but the same for bowel cancer screening, is lower in areas of economic and health deprivation. And it is something that we do have to look at, how we target these populations. So it is key that we continue to increase awareness of the importance of routine health appointments and modifiable risk factors. And while screening is generally increasing, the NHS breast screening programme found that 1 in 3 women still do not take up the offer of screening. It is key that we continue strategies which promote the uptake of screening in lower attending areas, as we've just heard from my honourable friend. For example, through these awareness campaigns, as well as reminder texts and mobile screening units and other ways. In preparing for this debate, I met with Breast Cancer Now, as well as Coppa Feel, the UK's only youth-focused breast cancer awareness charity. They also call for more screening of women who have a higher risk of breast cancer, as well as providing women identified with wraparound support. Diagnostics are key to successfully identifying those with breast cancer, although mammography is not always the best diagnostic tool, and I think that we have to realise that, particularly for younger women and those with dense breast tissue. And so it is important to invest in other diagnostics, for example MRIs, and to consider their capacity to be scaled and expanded. Younger women tend also to have denser breasts, which mammograms are worth analysing. As the scans are harder to interpret, this can lead to women having repeated scans and extended investigations. It's important to note that most European countries screen for breast cancer between 50 and 69. And although there is some variation in age ranges and frequency, for example, countries like Albania, Iceland and Sweden start screening at 40. Although breast cancer diagnoses for women under 40 are rarer, and about 4% of breast cancer cases in the UK are women under 40, when young women get breast cancer, they are much more likely than older women to have a family history of breast cancer and genetic mutations that are associated with increased risk. There is an ongoing trial called Age X, which is looking at the benefits of screening regularly women aged 47 to 49 and 71 to 73, given how little is known about screening women outside the ages of 50 to 70. The trial took place from 2009 until 2020, and 4 million women took part. The first report to come out in these trials is due in December 2026, with the final report in 2031. So it will be a few years before we know the findings from this trial. Other trials include the UK AIDS trial led by Professor Stephen Duffy, which looked into the effectiveness of annual mammographic screening for women in their 40s and found that the mortality benefit was greatest for the first decade after screening started. I will give way.
thank very much for the Honourable Lady for giving way. I'm proud to have walked the walk in my constituency of Woking, and they've raised a huge amount of money and awareness, and one of the country's leading breast cancer charities. They are pushing for mammogram testing to be extended. Does she agree with me that it should be extended to the under 40s and the over 70s? That could have a notable effect on fighting this deadly cancer.
Yeah, I thank the Honourable Member for his intervention, and I do agree, and I'm looking forward to hearing the Minister's response in relation to how we could take this forward. The UK National Screening Committee are still concerned with false positives, overdiagnosis and overtreatment. And in 2012, Sir Michael Marmot chaired an independent review of breast screening, which found that the current UK screening programme prevents about 1,300 deaths from breast cancer annually. However, he also found that overdiagnosis would mean for every death which was prevented by screening, around 3 women would be treated for a cancer they do not have. As breast cancer is less common in younger women, there is a concern that this would be much higher in the age group. False positive results can induce long-lasting anxiety and an unwillingness to reattend future screenings. It is important that screening programmes weigh up accurately the balance between potential harms and benefits, and I'm sure we'll hear more about this during this debate. It is a common misconception from some people that breast cancer is not a problem anymore, but as we know, more women die from breast cancers than other cancers. We need to do more to look after women in their 40s and women under 40. We need risk-adapted screening to better improve our chances of early detection in those most vulnerable. And I'm looking forward to hearing from other members today and to the Minister's response.
I remind members they should bob, which they are doing, if they wish to contribute. The question is that this House has considered E-petition 742179 relating to NHS breast screening. At this stage, I won't impose a time limit, but if you stick to about 5 minutes each, we should accommodate everyone. I call Lee Pitcher.
Thank you, Mr Vickers. It's a pleasure to serve under your chairmanship. And I congratulate my honourable friend, the member of North Ayrshire and Arran, on securing this debate, and I thank everyone who signed the petition. Behind every signature is a person, a family member or a friend who has faced the frightening possibility that cancer can be found or may be found too late, or even have had somebody that they've lost because indeed it was found far too late. In Bawtry, in my constituency, local people have painted the town pink over the last few years during Breast Cancer Awareness Month, and have also taken the time to promote a simple message inspired by the Legally Blonde movie, to bend and check. It's a powerful reminder that awareness, confidence and early action can save lives. And I'm really glad that Epworth may also be turning the town pink later this year under Kim Penfold, who is getting shops at the moment to raise to join in and turn their front shops pink. To raise awareness around early detection and screening. Now, this petition calls for routine breast screening to begin at 40 and to take place annually. That is a serious and understandable ask. We must, though, be guided by the evidence as well as the strength of feeling. And the current NHS programme invites women from 50 until their 71st birthday every 3 years. The Independent UK National Screening Committee has advised that, on the evidence currently available, lowering the age or increasing the frequency of screening could bring harm as well as benefits, and we heard that earlier from my honourable friend. Mammograms can be less accurate for younger women with denser breast tissue, increasing the risk of false positives, unnecessary tests and treatment. However, UK age trial findings of 160,000 women over 20 years show that annual mammograms for women in their 40s significantly reduces breast cancer deaths, saving a life per 1,000 women screened. One life, millions of memories. So we cannot stand still. The question raised by this petition is therefore entirely legitimate. I would be grateful if the Minister could confirm when Parliament can expect the UK National Screening Committee to consider the final AGEX trial findings, and how the evidence on additional screening for women with dense breast tissue will inform future decisions. Minister, we must also focus on the women already entitled to screening. Around 3 in 10 eligible women do not take up their invitation. This Labour government's work on digital innovations, mobile units, targeted outreach and more accessible equipment is welcome, but it must reach women in deprived communities, rural areas and communities where uptake is at its lowest.
Would my honourable friend give way on that point?
I will.
I thank my honourable friend for giving way. I recently visited the new breast care unit at County Hospital where Michelle Elliott's and Mr Seka Merla gave me a really fantastic tour. One of the things they spoke about actually was having separate areas as you walk into the breast care unit for those that are having treatment for breast cancer and those that are there for mammogram, because of the way that it basically scares women from going there if they're not confident that that's not what they're there for. So would my honourable friend agree with me that whilst more scans, more mammograms and better support are important, actually something as fundamental as the building design is also integral to making sure that women do take up that offer of getting their mammogram?
She certainly makes a really valid point, and the environment in which people walk into first actually does make a massive difference in terms of how you feel about continuing with potentially going forward with your screening. And I only went a couple of weeks ago with my wife to one of those areas. She had a lump in her breast, and I have to say the warmth, the welcome that she got as we walked in was just so amazing, put her at ease, put me at ease, so I could then support her, and actually made the whole experience as good as it could possibly be. And I'm thankful to say that she's doing very, very well as well. So I wonder if the Minister could actually just provide a bit of an update in terms of what the government is doing to promote and ensure that those people that are valid and can currently go for tests actually do go for those screening tests. Finally, no woman should wait for a screening letter if she notices a lump, a change in shape, skin changes or anything that does not feel right. Whatever their age, they should contact their GP. Early diagnosis gives people more options, more time, and too often the chance to see children and grandchildren grow up. And that's why this petition matters. And that's why, ultimately, we need to act upon it. Thank you.
Juliet Campbell.
In your chairship today, and I thank the honourable member from North Ayrshire and Arran for her thoughtful opening remarks, and I pay tribute to all of those affected by breast cancer, those facing diagnosis, their families and friends and carers who stand beside them. It is their experiences that make this debate so very important. And to my constituents of Broxtowe for signing this petition. I also thank the petitioner for starting the petition in the first place. I do welcome the government's ambition for the National Cancer Plan, and it commits the NHS to ensuring that by 2035, 75% of people diagnosed with cancer will be cancer-free and living well after 5 years after diagnosis. The plan will also develop further AI-assisted interpretation of images for suspected breast cancer diagnosis and will help us to detect breast cancer for women under 50, those with a more dense breast tissue. Under the last government, cancer performance targets have not been met since 2014, leaving too many women facing delays and poor health outcomes. However, I know that my constituents in Broxtowe want this government to go further and to include women aged 40 to be routinely invited for breast cancer screening. Because according to Copperfield, cases of breast cancer in under 50s is on the rise. And a recent report states that we've seen a 5% increase in the last year. Patients under 50 are more likely to have their symptoms missed and are more likely to be diagnosed at a later stage in their cancer journey compared to those over 50. This issue is even more pronounced for women from minority and ethnic backgrounds and for those from deprived and rural areas who have less access to screening opportunities within their communities. Therefore, additional public health attention needs to be paid to this. And according to breast cancer research, there are 10% more likely to begin treatment after the cancer has already become invasive, as well as being 20% more likely to require a mastectomy. So to achieve our cancer outcome aspirations, I ask the Minister to extend routine mammogram invitations to women from the age of 40, and I hope the Minister will also consider the rollout of alternative diagnostic measures that will affect the diagnosis of younger women.
Thank you, Mr. Vickers. It's a pleasure to serve in your chairmanship. Can I thank the honourable Member for North Ayrshire and Arran for securing this important debate on behalf of the Petitions Committee, of which I am also a member. Cancer is, of course, an issue that touches most of us nearly every single day, as we have no doubt all experienced a friend or a family loved one who has had cancer. And I'm grateful that this petition has given us all the opportunity to debate such an important issue. And on a personal note, this is an extremely poignant debate for me, as I lost 2 friends to cancer at the end of last year. Russell Brown, who served the Worth Valley as a district councillor on Bradford Council, and Chris Graham, who was a former Keighley town councillor who served the Longleat and Parkwood wards. And I know that their losses, their recent losses, are still being felt very much across the communities which I'm lucky enough to represent. I know that we have had several opportunities to debate the issue of cancer in this place, and rightly so. Today's debate is particularly important, given that breast cancer is the most common cancer diagnosed in women in the United Kingdom, and the second most common cancer overall, with around 60,000 new cases each year. But also, unfortunately, around 11,200 deaths each year, which equates to about 31 deaths every single day, which is, of course, far too many. Which is why this petition is so important, calling for early diagnosis, which is crucial, as has been outlined by many members, because according to Cancer Research UK, 76.6% of women survive for 10 years or more after being diagnosed, and 85% of those are diagnosed at an early stage. So I agree with the petition, and I'd like to thank Gemma Reeds for bringing this petition to this debate, and also all of the petitioners that have kindly put their name to it, including those across Keighley and Ilkley in my constituency, because it is right to call for early screening at the age of 40. And there is, of course, compelling evidence that early detection saves lives. Breast cancers identified at an early stage are genuinely smaller, less likely to have spread, and require less aggressive treatment. So early diagnosis and early screening is key. Not only can early diagnosis improve survival rates, but it also reduces the physical and psychological burden associated with advanced diagnosis and the disease spreading. However, it is equally important to acknowledge that screening for breast cancer is not a one-size-fits-all approach. Screening for younger women generally produces less accurate mammograms because the tissue is denser, making cancers more difficult to detect and increasing the risk of false positives. But it does happen, and that is why I again repeat the call of the petitioners that early diagnosis is key and incredibly important. My own sister was diagnosed with breast cancer at the age of 36, and having gone through chemotherapy, radiotherapy and having surgery, I'm pleased to say that she was on the mend. But it is again another example of an individual being diagnosed before the age of 40. And therefore, Mr. Chairman, that's why I think it is right that if there is a historic family association with breast cancer, that those that are under 40 have the opportunity of getting that early diagnosis. And, of course, I agree with the petitioners as well, that having a repeat opportunity of screening for annual checkups rather than every 3 years is, of course, important. Now, access to screening is not just about age, Mr. Chairman. It's about ensuring that those who are eligible for screening are aware of it and choose to take part. And I have major concerns about the lack of uptake across certain groups. It is, as has already been expressed in this debate, the least deprived areas that we know 81% uptake for breast cancer screening takes place, compared to 56% in the most deprived areas. So I'd be keen to understand from the Minister, who I know cares deeply about this issue, and I would commend the Minister for the work that she has done on this cause, and I know it is deep to her heart, but I'd like to understand from the Minister how the Government are looking to tackle this discrepancy. And I'd also like to understand from the Minister whether there is a plan for an annual screening programme to roll out rather than just that of every 3 years. Ultimately, I know that all of us participating in this debate share the objectives of reducing deaths from breast cancer and ensuring that women receive the best possible care. But that cannot be done without a fully funded long-term workforce plan, alongside a clear funded milestone showing how and when patients will see improvement. Mr. Chairman, I would like to put on record my thanks for the incredible work of the volunteers, campaigners and professionals who work tirelessly to help and support patients. This includes the mobile cancer screening units that operate within my constituency of Keighley and Ilkley as part of the Airedale Hospital team. But I would like to understand whether there is a plan from the government under the 10-year plan that has been rolled out and will continue to roll out for the NHS 10-year plan, whether or not this is part of the government's ambition. Because I feel that this petition is poignant, is asking for the right things from the government, and it does have my backing based on the amount of correspondence which I've received from petitioners and residents across my constituency in Keighley and Ilkley.
Dr. Scott Arthur.
Thank you, Mr Vickers. And you won't be surprised to hear it's a pleasure to serve under you today. And I do thank my honourable friend from North Ayrshire and Arran for the way in which she both introduced the debate and engaged with the petitioners. The UK's breast screening programme is one of the greatest successes of our NHS. In Scotland each year, around 130 lives are saved by screening alone. The programme provides critical early diagnosis, improving both treatment options and outcomes for patients. Even in the worst cases, early diagnosis can give women precious extra time with their family and their friends. However, the petition before us today asks if this is enough. The screening used between the ages of 50 and 71 does not account for the 1 in 6 people diagnosed with breast cancer each year below 50, and there will be many more whose diagnosis comes later. And tragically, often these diagnoses do come too late. Studies from the USA show that women diagnosed with breast cancer under 40 are 40% more likely to die from their cancer. And in the UK, breast cancer is the leading killer of women between 29 and 40. Worse still, when women present to a healthcare professional with breast cancer symptoms, the charity Copperfield tells us that they're often routinely dismissed, no doubt dismissed as menopausal. It seems to often happen to women. This creates missed opportunities for treatment. These missed opportunities will sadly only increase as the rate of breast cancer among younger women increases, and we've already heard that that is happening. While rates of breast cancer are increasing in all age groups, the incidence rates in younger women are growing faster than older. These facts should lead us to ask whether it is time to reconsider our current approach to screening. I recognise the petition's proposal of transitioning to annual screening and lowering the screening age could represent significant challenges to the NHS. Annual testing would require significant additional resources and patient buy-in. Younger women's breasts are often denser and therefore harder to scan, throwing up more anxiety, inducing false positives. However, these are simply challenges that should not discourage us from wanting to do more to support these women. Innovations like Copperfield's 7-minute risk assessments could help us to improve and expand targeted screening to younger women with predispositions to breast cancer. And increased resources and publicity in this area will only drive up uptake amongst all women. To close, I do want to recognise the work being done by Copperfield, ASDA and also the House of Hope in my constituency. Copperfield's report into the impact of brain cancer diagnosis on younger patients have informed many of us here today. And I pay tribute to the organisation's partnership with ASDA and their Tickle Pink campaign. In Edinburgh South West last year, ASDA Cheshire donated £2,700 to the House of Hope in Gorgie. It is Scotland's first bespoke support centre for those living with cancer, and it provides care rather than treatment. It's about supporting women and their families. Every day the centre provides life-enhancing support, and its impact is in just its first year of operation cannot be understated. The House of Hope would also not be what it was without the commitment of its founder, Lisa Fleming, who since her diagnosis at 33 has been a tireless advocate for the cancer community, and I'm proud to call her my constituent. Both she and her mother were on my Facebook page this morning trying to influence this debate. Both are formidable. But when I met her mother a week or two ago, it was a reminder that when a young woman does get breast cancer, it's our loved ones, our children and also our parents that are affected by it. And I think that wider economic impact should be taken into account in our decision making. It's through work like Lisa's and I hope a renewed commitment from the Minister to improving our screening processes that we can continue to make the steps against this terrible disease. And I do feel obliged to have a question for the Minister. So I hope she will promise me that the next time she visits Edinburgh, she'll stop her ministerial limousine at the House of Hope and pay Lisa a visit. Thank you, Mr Vickers.
Clive Jones.
It's a pleasure to serve under your chairship, Mr Vickers, and I thank the Honourable Member for North Ayrshire and Arran for securing this very important debate, and the Minister for attending the debate today. I'd also like to congratulate Gemma Taylor for organising this well-supported petition and for her campaigning on this very important issue. Being diagnosed with breast cancer is a bewildering and terrifying experience for far too many people, as many of us know. Breast cancer is the most common cancer in the UK. Around 60,000 people are diagnosed every year, and 1 in 7 women will receive a diagnosis during their lifetime. Early diagnosis is crucial. Detecting breast cancer sooner gives people the best chance of successful treatment and ultimately saving lives. In my own case, I had to visit my GP twice before receiving a diagnosis. Between visits to the GP, the cancer spread to my lymph glands. The result of spreading to my lymph glands still causes issues for me today, 18 years later. But thankfully my treatment was successful, but many others are not so fortunate because of delays in diagnosis. More than 95% of people diagnosed at stage 1 survive for at least 5 years, compared to around 25% diagnosed at stage 4. That is why breast screening is so important. The Marmot Review estimated that the current screening programme prevents around 1,300 deaths every year, yet uptake remains too low, particularly in England, where rates lag behind both the devolved nations and pre-pandemic levels. Almost 30% of eligible women are not attending screening appointments. Around 600,000 women are missing the opportunity for early detection. Research by Cancer Research UK found that concerns about pain are the most common barrier to attending. Others miss invitations, struggle to find the time, or remain unconvinced of the benefits. Uptake is even lower in deprived communities, worsening existing inequalities in cancer outcomes. In England in 2025, screening uptake was 65% in the most deprived areas, compared with 75% in the least deprived areas. The government needs to work on ideas to improve access to screening, particularly where uptake is the lowest. Simple measures such as follow-up invitations, cultural appropriate information, and community-based pop-up screening services could make a real difference by meeting people where they are and at times that work for them. Will the Minister outline what plans the government might have to increase screening uptake, particularly through community-based services? However, improving uptake alone is not enough. Serious workforce shortages and outdated equipment continue to delay diagnosis and treatment. Too much diagnostic equipment is aging or even no longer fit for purpose. Many areas face shortages of radiotherapy capacity, faulty mammography equipment, and insufficient staff to operate machines consistently. I have long called for greater investment in the NHS workforce, including during debate in Westminster Hall last year. While I welcome the government's National Cancer Plan, the commitment to provide 28 new radiotherapy machines falls well short of what is actually needed. Instead, the government should be looking to provide at least 200 additional machines that are required to tackle the backlog and ensure timely diagnosis and treatment. That is why my Liberal Democrat colleagues and I have called for a 10-year capital investment programme so every cancer patient can benefit from faster, more accurate diagnostics and treatment. So I asked the Minister, what further plans does the government have to invest in both the workforce and the equipment needed to improve breast cancer outcomes? We know breast cancer screening works. We know early diagnosis saves lives. Now the government must ensure that everyone can benefit by improving uptake and providing the investment that our cancer services urgently need. Thank you, Mr. Vickers.
Thank you, Mr. Vickers. It's a pleasure to serve under your chairship. I would like to start by thanking my honourable friend for bringing this debate, and to all those who signed the petition, and to all those who have campaigned to raise awareness. Breast cancer is one of the most common cancers in women in the UK, and whilst there may be a lot of talk today of statistics, everyone knows that the impact of breast cancer isn't a number on a chart or in a table, it's real life and it's heartbreaking. It's a mother, a daughter, a sister, a friend, a colleague. Almost every one of us knows someone whose life has been touched by this terrible disease. We know the earlier breast cancer is detected, the greater chance of successful treatment. Screening remains the route most likely to find breast cancer early. The 2012 Marmot review we've heard found that our screening programmes prevent over 1,300 deaths from breast cancer every year. So I completely understand where the petitions are coming from, because even one misdiagnosis feels like one too many. That concern is real and it deserves to be taken seriously. The story of my friends Laura Turnbull, mum of Lewis, Josh, Alfie, Zach and wife to Richard, and Anne Wise, mum of Lewis and Lauren, have brought this home to me all too painfully. Both were under 50 and both had at least one remission, reached remission once, but both sadly saw their cancer return in different forms, tragically cutting their lives short. And Mr. Vickers, I'd like to say and send some love to their families, especially Anne's, because it's her funeral on Saturday. Sadly, Laura and Anne are not alone. More than a decade ago, I lost another friend, Fiona Bennett, whose breast cancer reached her too before she was 50. These stories are powerful reminders that breast cancer does not only affect older women, and why so many people are asking what more can be done. That is why we should follow the science. As new evidence emerges, as technology improves, and as we learn more about detecting breast cancer earlier and more accurately, our screening programme should continue to evolve to ensure it delivers the very best benefits to our patients. But Mr. Vickers, alongside that, we must not lose sight of the opportunity we already have. In 2025, only 70% of Portsmouth women aged 53 to 70 attended the breast screening in the last 36 months. That's more than 4% behind the average of local authority districts in the South East, and the gap has been widening in recent years. Whatever changes may come in the future, we must also make sure that every woman who is currently eligible takes up the opportunity to be screened. For me, improving the uptake amongst those already eligible must be an absolute priority. So I'd like to ask the Minister how we are identifying the barriers and what we are doing to break them down. Sadly, we know and we've heard that the levels of deprivation directly affect screening attendance, and that is why I welcome the government's new cancer plan, which will include targeted campaigns to improve screening uptake in deprived and underserved communities, helping to ensure that where you live or what you earn does not determine your chance of cancer diagnosis. So can the Minister say more about that, please? Unfortunately, after 14 years of Conservative mismanagement, the NHS did never meet its cancer targets since 2014. And England's cancer survival rates have slipped more parity behind other countries, and that is not good enough. I think it's so important that as we discuss expanding access to breast screening, we also recognise that the quickest way to undermine that principle would be to move towards an insurance-based healthcare system, as advocated by Reform UK, as this could alienate even more people and stop even more people taking up that screening opportunity for fear of what it would cost. Labour has set out an ambitious reforms to cancer diagnosis and treatment that are expected to save more than 320,000 lives over its lifetime. More scanners and advances in diagnosis technology means we will have a real opportunity to diagnose cancers early and improve outcomes that alongside by shifting more healthcare into our communities, our neighbours. And we can make screening more accessible and less daunting. so that Portsmouth women will attend, be they health hubs on the high street, opening their hours at weekends, early mornings or in the evening, and giving a wider access. And I would welcome to work with the Minister on how we can get these diagnosis centres open in Portsmouth North so that we can raise that number from 70% to 100%. Today's debate isn't about choosing between improving today's screening programme or preparing for tomorrow. We must do both. We should continue to listen to clinicians, researchers and campaigners and be prepared to strengthen and adapt the programmes as the evidence develops. At the same time, we must ensure that every woman who is entitled to screening, be that because of age, family history or symptoms, is encouraged and supported to attend, because a screening programme only works if people use it. Mr Vickers, every invitation accepted is another chance to detect cancer early, another opportunity for less invasive treatment, and another family spared from the devastating news. If we can continue to improve the science, widen access where the evidence supports, and ensure more eligible women come forward, we will save more lives and spare more families the heartbreak of Laura, Anne and Fiona, and many others. Thank you.
Polly Billington.
Thank you, Mr Vickers, and it's a pleasure to serve under your chairship. I'd like to thank my friend, the member for North Ayrshire and Arran, for leading this debate. Now, Gemma Reeves is a breast cancer nurse at my local hospital in Margate, the Queen Elizabeth the Queen Mother Hospital. She started a petition, which I noticed on my Instagram feed a few months ago, calling on the NHS to establish annual mammograms for 40-year-old women. And I noticed that it was getting a lot of traction on my feed and that a lot of people I knew were signing up to it. I explored more and wanted to understand where this policy would end up. And then, of course, my colleagues will recognise this, like many things, it became another one of those campaigns that I said I would do. One day, however, I found that Gemma was up here in Westminster with her son, Mason, and I came to meet her in Central Lobby. She told me what she had seen as a breast cancer care nurse at work in the hospital in Margate during the pandemic and since. It was an increase in the number of women presenting under 50 with breast cancer. What she saw corroborates Copperfield's research that breast cancer in young women is on the rise. She became increasingly concerned that people she was caring for had not had the screening that might have meant that when they presented at hospital, finally, their cancer was not so advanced. Now, more than half of all breast cancer cases in the UK occur in people outside of the national screening age. 1 in 6 are under 50. Now, I know from having had those conversations with Gemma then, and then since with my right honourable friend, the member for Washington and Gateshead South, that there are many challenges that come with tackling breast cancer in women who are under 50. We need to work out what is the best way of tackling breast cancer in younger women. I'm delighted that the Minister met with myself and Gemma and her friends, who previously were just her patients, and now they have become not just her friends, but also her co-campaigners, because they have experienced getting breast cancer under 50 and have found that they too wish that there had been some kind of screening in order for them to be able to have their cancer identified earlier. We know, and many people who will be contributing to this debate will know, that actually screening, as we've currently got it, is designed for older women. Mammograms are designed for women who are over 50. And therefore, if we're looking for a way of screening young women, we may need to think and explore different kinds of technologies, from MRIs to ultrasound. We also need to avoid the situation where you have false positives, as many of my colleagues have referred to, where women could end up fearing that they've got breast cancer, more women end up fearing they've got breast cancer than actually do, because we introduce screening which could produce those false positives. And we also need to recognise that for many people, having some kind of early test or check-in, including things like family history, would enable them and their medical carers to spot the risks that they are exposed to and whether they should go for early screening. Whatever, it is clear that the status quo is not acceptable because it is not built for young people. It is also clear that the evidence currently of occurrence of breast cancer under 50s is out of date. The most recent evidence is 2018. And so therefore I'm absolutely delighted that Gemma has been able to come forward and lead this campaign, gathering so many signatures to her petition from across the country and particularly in East Kent. And I hope therefore that the Minister will take seriously her request, not only that we publish the evidence, but when the evidence is published, that we act on it. that we find new ways of making sure that women who are younger than the current screening age of 50 are able to access that screening, to be able to make sure that they get their breast cancer spotted early. One of our big missions in our mandate from the election was that we would tackle healthcare via prevention. 30% of breast cancers could be prevented through exercise, diet and alcohol control. But also, the earlier women are screened, the more likely it is that we're able to prevent more illness and more deaths. And that's why I have been supporting Gemma in this campaign, and I hope the Minister will be able to be sympathetic to exploring further ways of us making sure that young women can be confident that their breast screening is able to spot any cancer early.
Thank you. It's a pleasure to serve under your chairmanship, Mr Vickers, and I'd like to begin by commending my honourable friend for North Ayrshire and Arran for leading this important debate and setting out the arguments so clearly. I welcome the petition upon which today's debate is predicated, and I recognise the calls from the petitioners, including the 141 people from Mid-Cheshire who signed the petition. I believe that any measures which can increase breast cancer diagnosis rates, improve treatment options, enhance survival and ultimately save lives must be carefully considered. A diagnosis of breast cancer is devastating at any stage, but when it comes too late, when opportunities for early detection have been missed, the consequences are profound and irreversible. Behind every statistic is a person, a family, a future altered forever. Today, I want to focus on the story of my constituent, Sarah. Sarah was identified as being at a higher risk of developing breast cancer due to her family history. In March 2020, she took the responsible step of seeing her GP and was referred for genetic testing. But as the COVID-19 pandemic took hold, all non-symptomatic breast screening, including family history assessments, was paused locally. Sarah did everything right. She repeatedly followed up, sought answers, and was reassured she remained on a waiting list. But that appointment never came. Just over a year later, in May 2021, Sarah found a lump in her breast. Following investigations, she was diagnosed with triple-negative breast cancer, an aggressive form of the disease. She underwent a mastectomy and chemotherapy, but even then, her journey was marked by delays in test results and the start of treatment. Less than a year later, in April 2022, Sarah discovered another lump. This time, the cancer had spread. What had once been treatable was now incurable. Treatment could only manage, not cure. Again, delays followed, delays that no patient in such a fragile situation should ever endure. But despite this, Sarah wrote, "I would like to make it clear that I very much appreciate the care and support I have received, despite the obvious, overwhelming and continuing pressures on the NHS. Almost every single NHS employee has been extremely kind and professional and have made many difficult experiences at least a little easier. They appear to share many of the frustrations." Tragically, Sarah passed away in May 2024, aged just 46. Even in the face of her own mortality, Sarah fought for change. She spoke out about her experience and called for improvements to ensure timely testing and treatment. Crucially, she argued that non-symptomatic screening must never again be paused, even in times of crisis, because early diagnosis saves lives. Sarah was absolutely right to highlight the significant impact that pausing non-symptomatic screening had on early diagnosis, treatment options and patient outcomes. Any disruption to early detection has lasting and devastating consequences. Her call to ensure that future pandemic preparedness protects vital screening services must be heeded. After Sarah's death, her husband, Dave, carried forward her campaign with extraordinary courage and determination. His advocacy, born of grief, was both powerful and inspiring. But tragically, Dave took his own life a few short months ago. We cannot let their story end here. Their experience lays bare the cost of delay, the cost of inaction, and the cost of systems that fail to prioritise early diagnosis. We must act by strengthening screening programmes, ensuring resilience in times of crisis, and delivering timely care for every patient. Let this be the legacy of Sarah and Dave. not one of loss alone, but of change. We owe it to them and to every family to ensure that no one else endures what they did. Thank you.
Hear, hear, hear.
To the front benches, and I call Helen Maguire, Lib Dem spokesperson.
Thank you, and it's an absolute pleasure to serve under your chairship, Mr Vickers, and I thank my honourable friend, the member for North Ayrshire and Arran, for leading this important petitions debate on NHS and breast screening. And it's hard to follow the honourable member after his passionate speech just now. But this is important because in the UK, there are around 60,000 new cases of breast cancer each year. This represents 15% of all new cancer cases and 30% of all new female cancer cases. Breast cancer is the most common type of cancer for women. A woman is diagnosed with breast cancer every 9 minutes. There are approximately 11,200 deaths due to breast cancer each year in the UK. The human costs behind these statistics cannot be overstated. In the short span of today's debate, 10 women will be diagnosed with breast cancer, whilst 2 will tragically lose their lives to the disease. Over the recent decades, we've made huge strides in the diagnosis and treatment of breast cancer. It is remarkable that now approximately 76% of women survive for 10 years or more following their diagnosis. But like any cancer, diagnosing breast cancer early remains vital and saves lives. Breast cancer remains the most effective way to detect, breast screening remains the most effective way to detect cancer at an early stage, which is also when treatment is most likely to succeed. Over 95% of people diagnosed at stage 1 will survive for at least 5 years, compared with around just 25% diagnosed at stage 4. The Marmot Review estimated that the current screening programme prevents around 1,300 deaths a year. In 2024 to 2025, 2.75 million women aged 50 to 71 were invited to be screened, a 10% increase on the previous year. 2.15 million women took this screening offer up. Nearly 20,000 women had breast cancer detected through this screening. But as this figure also highlights, there are around 600,000 women not taking up the essential offer of breast cancer screening. Recent screening data reveals an alarming trend of women not attending their first screening appointments. The impact of not taking up these screening offers only compounds this issue. Women who don't attend their first breast cancer screening appointment are much less likely to take up subsequent screening invitations. In 2024 to 2025, only 20.9% of women in England who had never previously taken up screening invitations attended, compared to 89.1% uptake amongst women who'd previously been screened in the last 5 years. Screening uptake for the first-time invitations has never reached 70% since the creation of the modern NHS breast screening programme. Had screening uptake levels reached the NHS achievable standard target of 80% in 2024 to 2025, over 250,000 more women would have undergone routine screening. This would have resulted in an estimated additional 2,228 breast cancers being found. The scale of this missed opportunity to catch more cancer early is unacceptable, and women and their loved ones are ultimately paying the tragic price. I take the opportunity now to urge anyone who is eligible to take up the offer of breast cancer screening. The Liberal Democrats are clear. So much more must be done to ensure that every eligible woman attends screening when invited, particularly in England, which is lagging behind the devolved nations as well as pre-pandemic levels. There are many reasons why women don't attend their breast cancer screening appointments. For example, misconceptions about the screening process in breast cancer, the fear of receiving a diagnosis, or cultural beliefs and attitudes. Others may not be able to attend due to everyday challenges such as limited transport, clashing work schedules, or the burden of care and responsibilities. Health inequalities also affect screening uptake. Women from ethnic minority communities, those living in disadvantaged areas, and women with disabilities often face additional barriers that reduce their access to breast screening services. So I ask the Minister, what actions are the Labour government taking to improve screening uptake nationally, particularly among disenfranchised women? What steps is this government actively taking to support pop-up screening initiatives in community settings? And what is being done to ensure that these vital health services are meeting people where they are and at times that work for them? I also ask the Minister what steps she is taking to ensure that women are able to receive the best screening tests for their individual health needs. For example, providing women with an increased risk of breast cancer the opportunity to have an ultrasound if they're unable to go an MRI for any reason and if they have dense breasts, as well as younger women at increased risk for whom an ultrasound will provide greater accuracy in screening their dense breast tissue. As mammograms can struggle to identify cancer in dense breasts, as both cancers and dense tissue present exactly the same on imaging. So the Liberal Democrats are also very concerned that so much NHS equipment, including diagnostic and scanning equipment, is out of date and decrepit. A quarter of England's 280 radiotherapy machines are now operating beyond their 10-year lifespan, with a further 26 due to exceed their recommended lifespan by 2027. England has fewer radiotherapy machines than comparable European countries. Radiotherapy's UK's research reveals that England has just 4.8 linear accelerator machines per million population, well behind France that has 8.5 and Italy at 6.9. Radiotherapy also lacks clear accountability. While responsibility for commissioning radiotherapy sits with ICBs, Freedom of Information requests found that around 70% of ICBs do not have a named person responsible for radiotherapy. Access to radiotherapy is well below international expectations. Around 52 to 53% of cancer patients are estimated to need radiotherapy, but only around 35% of cancer patients in England actually receive it. In some areas, this is as low as 22%. Radiotherapy also has the longest waiting times. Only around 4 in 10 patients receive radiotherapy on time, and in some areas of the country, this is as low as 2 in 10 receiving radiotherapy on time. Whether it's radiotherapy deserts or a mammogram machine glitch that left 7,000 women in parts of Essex without a screening service for almost 2 months, breast cancer patients are routinely being let down by faulty and inaccessible equipment. This is unacceptable and we must take action now. In order to address this, the Liberal Democrats are campaigning for a 10-year capital investment programme. This would ensure that every patient, including women with breast cancer, benefit from easier access to newer, quicker and more accurate machines. Alongside screening, speed and quality of treatment are central to increasing survival rates of breast cancer. The Liberal Democrats would introduce a guarantee that 100% of patients will be able to start treatment within 62 days from urgent referral. We'd also replace the ageing radiotherapy machines and increase their numbers to guarantee that no one must travel ridiculous distances to receive the treatment that they desperately need. Currently in England, 3.4 million people live further away than the NHS target of 45 minutes for a radiotherapy centre. Taking these steps now is vital. We need to prepare our local cancer services for the future as demand is increasing, because cancer cases are expected to rise by about 30% by 2040. The new national screening programme is also likely to identify more patients who need curative radiotherapy treatment, and the existing pressures on radiotherapy services will only worsen without urgent action. Additionally, we'd recruit more cancer nurses so that every patient has a dedicated specialist supporting them throughout their treatment. We would also halve the time for new treatments to reach patients by expanding the Medicines and Healthcare Products Regulatory Agency's capacity. The future also looks bright, with early pilots and trials using AI to analyse mammograms, showing promising signs of potential improvement in both the speed and accuracy of screening. But we must support our life sciences sector much more than we currently are to champion vital research and innovation. The Liberal Democrats would pass a Cancer Survival Research Act requiring the government to coordinate and ensure funding for research into the cancers with the lowest survival rates. To end my contribution to this debate, I want to reflect on the 10 women who were diagnosed with breast cancer and the 2 who will have tragically lost their lives to the disease in the short span of today's debate. For them and the thousands of women, of people, mostly women, but also men, living with breast cancer and their loved ones, I urge the Minister to carefully consider the important points and perspective raised in the debate today. Thank you.
Minister Dr. Caroline Johnson.
Thank you, Mr Vickers. It's a pleasure to serve under your chairmanship this afternoon, and I would like to congratulate also Gemma Taylor for bringing forward this petition, and the member for North Ayrshire and Arran for securing this important debate. It's been very moving this afternoon to hear so many stories from honourable members across the House that have reminded us of the human cost of this disease. Breast cancer is very common, as other members have said, affecting 1 in 7 women during their lifetime. And the Minister and I have a number of debates in this chamber about various different diseases and different forms of cancer. And one of the core principles we often discuss is the principle that early diagnosis saves lives. And Cancer Research UK say that 85% of women who live more than 10 years after a diagnosis of breast cancer were diagnosed at stage 1 or stage 2, so the earlier stages to be diagnosed at. And it's for this reason and for this principle that the UK introduced the world's first national screening programme for breast cancer in 1988, and since then very much has changed. In particular, the survival rates have improved dramatically, now at 76.6% living more than 10 years. It was very much lower in the 1980s. But there are still some issues with screening, as honourable members have said. One issue is that women with denser breasts find it more difficult to locate lumps, and also it can be more difficult when doing the mammograms to locate cancerous tumours. And so it may be that the Minister can update the House on what work has been done looking at ultrasounds and MRIs as different methods of screening that could be used to identify tumours in women with a denser breast. The NSC, the National Screening Council, I understand are looking at this subject in detail. Could the Minister tell us when they're due to report their findings to her and when she intends to bring them to this House? Things affecting the treatment include the effectiveness of treatment, which, as we've said, has improved. The risk of over-treatment, which we know is higher in younger women, but also the frequency of the disease, the incidence of the disease, which is increasing. It's increasing in younger women and in older women. And the figures I got from the Cancer Research UK website were that within women 25 to 49, the rate has increased by 12%, and in women aged 65 to 69, it's increased by 72%, which begs the question, should younger women be now receiving screening? And it also begs the question, should women who are older women be receiving more frequent screening? The cancer plan that the government published earlier this year, Chair, said they would engage with manufacturers to look at mammograms that are more accessible to those with physical disability who may struggle to receive their screening at the moment. I wonder if the Minister could update the House on what engagement she's had so far with such manufacturers and what progress is being made. Likewise, the age trial in Oxford is looking at women between 47 and 49 and 71 to 73 years. So these are the ages just outside the current range of screening. I understand early results are due in December 2026. Has the Minister had any indication yet? And is she preparing for any results that may come forward? Has she engaged with the people running this important trial? The community diagnostic centres initiated by the previous government and rolled out across the country are really providing a screening localised to people's homes, which makes it much easier for people to attend. Can the Minister update us on how she's working on improving the number of CDCs available across the country? The government has talked, Chair, of these different shifts that it wants to produce in the healthcare, and one of them is about prevention. And according to the Cancer Research UK website, prevention 23% of breast cancer cases are preventable. And I wonder if the Minister could update us on what she's doing to try and reduce the number of preventable cases of breast cancer. Many honourable members have talked about the attendance at screening tests. And the Lib Dem spokeswoman spoke about some of the reasons that women may not attend for screening. I think it's really important that we understand why women are not attending for screening. It's around a third of women that don't attend, and it's only by understanding what puts women off, what makes them not attend, that we can help to improve the service so that more women do attend. And it was very sobering to hear just how many more lives could be saved if more women attended the screening. And so how are we making it more accessible for women to get there? How are we making sure that women know that it's happening and that they need it and understand the benefits for it? Again, the Minister, be interested to hear her thoughts on this topic. Another shift, Chair, is the shift in relation to the digital NHS. And AI provides us with a number of different ways in which breast cancer screening and treatment could be improved. It could help us with understanding who should be invited to screening and how often they should be invited for their screening. But it can also help to look at the mammogram scans. And with the Health Select Committee a few years ago, Chair, we did a visit to Stanford in California, and we looked at the AI there, where they were comparing the radiology consultant looking at a scan, 2 radiology consultants versus 2 AI computers of different programs versus a person and an AI computer. And what they discovered is that the person and the AI computer found the best level of accuracy. But that helps to reduce the number of people we need in terms of workforce and can help improve the accuracy of screening results, which is important. And that brings me on to the workforce, Chair. We know that the government has a workforce plan. We know that it's not been published yet and it's much delayed. We've been told repeatedly over the last few weeks that it's gone to imminent status, imminent being quicker than soon, but we don't know when imminent is. And I've encouraged the Minister to say, does that mean it's going to be published before the summer, or is it waiting for the new Prime Minister to make a decision? But it would be helpful to know, because we know, as has been talked about with radiology and radiotherapy, workforce is incredibly important, and we do need to have a thorough plan. Otherwise, we'll find ourselves with recommendations from the NSC for screening and no people to provide that care. I also wanted to raise with ministers the lobular moonshot programme, which we've talked about in previous debates, the importance of lobular breast cancer, which is more difficult to diagnose and treat, and the research into it. And I know the Minister, last time we spoke about this, was looking at research projects the government would be able to fund, which would hopefully save lives and identify new treatments and new ways of screening for this disease. And I wonder if she could update us on how she's getting along with that. In addition to that, Chair, much of my time at the moment is spent with one of the other ministers in Committee Room 9 discussing the health bill, and that's where I'll be tomorrow. And that's one of the important organisational factors in screening. So at the moment, the screening programmes are generally organised by NHS England, and NHS England is being abolished. And NHS England and DHSC wrote a letter in March saying that commissioning responsibility will be directly delegated to the ICBs in the same way as they are currently delegated to NHSC by the Secretary of State. So does the Minister expect this to cause any disruption to the breast screening programme? We know that the integrated care boards have had their budgets cut by 50%, just as they're asked to take on this work. We know they're merging and reorganising themselves. We know that the Minister's plans are that they should follow the mayoral authority boundaries, but that the mergers that have taken place so far do not follow those mayoral boundaries, and therefore there is a risk that in order to do that we'll need further reorganisation all over again. And so does the Minister think that's going to have an effect on the screening programme? And if she does, what is she doing to mitigate that effect, to make sure that as many people as possible get the very best screening as possible, so we can reduce the number of people who suffer from this disease? So in summary, Chair, I think the screening programme offers a real opportunity to diagnose early and treat early and save lives, but it needs to be delivered well, and we need to ensure that we make sure that the right people get the right type of screening at the right age and the right frequency. And I'm interested in the Minister's response. Thank you, Chair.
Minister Sharon Hudson.
Thank you very much, Mr Vickers. Okay, how long have I got? I've got a lot to get through. Let's see if I can make it. I would like to start by thanking my honourable friend, the member for North Ayrshire and Arran, for opening this debate on behalf of the Petitions Committee, and also like to thank my other honourable friend, the member for East Thanet, and her constituent Gemma and her son Mason, and the other ladies who've joined us in the gallery today for their campaigning to bring this petition and to gather so many petitioners that we are able to have this debate today, because it's very important. So I thank them and pay tribute to them and thank them for joining us. I was very, very pleased to be able to meet them last month to discuss this very important issue. I'd also like to take this opportunity, if I may, to pay tribute to my predecessor, my honourable friend, the member for West Lanarkshire. I commend her constant courage in speaking so openly about her experience as well of breast cancer, and I send my very best wishes to her throughout her ongoing treatment. And I know that behind all the figures we're discussing today, there are women, families and communities who've been affected by breast cancer in the most difficult and personal ways. Women and men, I have to add. I also want to pay tribute to NHS staff in breast screening services across the country who work tirelessly to ensure that women and men are offered this important preventative measure. Last year, our highly effective NHS breast screening programme screened nearly 2 million women, and each year the programme is estimated to save around 1,300 lives. But we must also be honest about the scale of the challenge. Around 11,500 women still die from breast cancer each year. Many thousands more go through treatment with all the fear, uncertainty and disruption that brings for them and for the people who love them. And that is why I want to be clear. We need to do more, and we will do more. The National Cancer Plan published earlier this year sets out how we will improve outcomes for breast cancer patients. We will speed up diagnosis and treatment, ensure patients can access the latest treatments and technology, and ultimately drive up this country's cancer survival rates. The plan commits to rolling out breast pain clinics nationally by the end of this year. It also builds on successful initiatives such as mobile breast screening units. And Cancer Alliances will receive funding to work proactively with local communities and providers so that more cancers are diagnosed earlier. Now, I want to refer to issues that were raised by the Honourable Member for Edinburgh South West, Wokingham, Broxtowe, Portsmouth North, and the Honourable Lady who speaks for the Lib Dems. There might have been others, but it's what I've scribbled down about issues around on serving ethnic minority communities as well as underserved and deprived communities. Building on successful initiatives such as mobile breast screening, which I mentioned, Cancer Alliances will receive funding and work proactively with local communities and providers to improve early diagnosis rates, and they will focus on increasing awareness of symptoms, support primary care to spot signs of cancer early, and that work will also include raising awareness of cancer symptoms, supporting primary care to spot signs of cancer early, reducing the gap in screening uptake between the most and the least deprived areas. And there will be particular efforts to reach ethnic minority communities and underserved groups because no one should be left behind. And the NHS also runs the Help Us Help You campaign in England. This campaign is helping to increase knowledge of breast cancer symptoms, address barriers to acting on them, and encourage people to come forward as soon as possible to see their GP. And I understand why many people ask whether screening should begin at a younger age. And it is a deeply human question, often asked by people who have seen firsthand the impact of breast cancer. And so we are looking carefully at the evidence. And the picture, however, is complex. And I'm going to come on to everything everyone has raised. Younger women tend to have denser breast tissue, as we've heard, which can make mammography less effective. Screening can save lives, but it can also cause harm through false positives, unnecessary tests, avoidable anxiety and overdiagnosis. That is why decisions must be made carefully and on the basis of robust evidence. Honourable friends from Doncaster East and the Isle of Axholme, Broxtowe, Edinburgh South West, and no doubt other colleagues again raised this issue, and as we know, some women will have denser breast tissue, and unfortunately mammography is less effective, as I've said, on dense breast tissue, as potential cancer can be harder to spot. So we are working to find the best solutions to this issue. And a study called BRAID, the Breast Screening Risk Adaptive Imaging for Density, is looking into whether supplementary imaging techniques like MRI or ultrasound could be used for women with breast with dense breast tissue. The independent UK National Screening Committee is in contact with the researchers and is reviewing the evidence as it becomes available. And ministers in the department will consider, and across government, will consider their recommendations as soon as they are made. The Age X breast screening trial is the biggest trial of its kind ever undertaken, and a number of colleagues asked about this also. It will provide robust evidence about the effectiveness of screening in age groups above and below the current screening age. And this trial has been looking at the effectiveness of offering some women one extra screening between the ages of 47 and 49 and one between the ages of 71 and 73. And AGEX is the biggest trial of its kind ever to be undertaken and will provide robust evidence about the effectiveness of screening in these age groups, including the benefit and harms. The UK NSC will review the publication of the AgeX extension trial when it reports. The trial began in 2009 and results are expected in 2027. I know the Honourable Member for Keighley and Ilkley asked me about that, I think. Screening trials require extended follow-up periods to generate robust evidence on whether screening reduces disease or death, while also assessing any potential long-term harms. And the UK NSA continuously monitors emerging evidence through horizon scanning and maintains active engagement with international peers. And should robust evidence regarding the extension of the breast screening age thresholds become available, the committee will look at this right away. And in the meantime, though, NHS England has produced a suite of public-facing information resources communicating that women, especially aged over 71 or over, can have screening every 3 years if they so wish. I was asked about, the member for Keighley and Ilkley asked me about why we don't screen annually. That was exactly, in particular, what he asked me about. The 3-year intervals of the National Breast Screening Programme is based on a successful Swedish trial. The frequency of screening balances the risk of harm from overdiagnosis with the benefits of early detection, and women at high risk of breast cancer are often called more frequently. So, also, I will, and help me.
Minister, because the petitioners are calling to lower the age for when you're able to be first called to 40, and then the rollout, as I asked in my question, to an annual basis for screening rather than every 3 years. Can I just simply ask, I know that the government aren't intending on doing that because we've seen the written response from the government in advance of this debate, but what further evidence does the government need to be able to achieve what the petitioners are asking?
As I said, the AgeX trial has been running since 2009. That has been looking at younger and older, and that is due to report next year. So hopefully the evidence will be there. That hopefully might be the further evidence that will be needed, but that is already in train, and these decisions are not taken lightly, as I'm sure he appreciates. The opposition spokesperson also asked me about AI. We are also supporting the early detection using information technology in health, or the EDITH trial. This will test new AI technology that could enable one specialist rather than 2 is currently required to complete the same mammogram screening process, increasing capacity in the screening system while maintaining patient safety. And we are entering a new era, as I think we all realise, in science and technology, and advances in data, genomics and predictive and analytics will allow the NHS to deliver care that is more personalised, more proactive and better matched to each person's individual risk. And new tools such as liquid biopsies and other non-invasive tests may help us detect cancer much earlier and often before symptoms appear. And the NHS is preparing to seize these breakthroughs so that patients can benefit from the full power of modern innovation. And the National Cancer Plan has identified priority areas to accelerate access to new technologies, and these include artificial intelligence-assisted interpretation of pathology images for suspected breast cancer diagnosis, and we will continue to horizon scan for better methods of screening and to build the evidence base for any future changes. Our ambition is clear. It is to save more lives, diagnose cancer earlier, and do so in a way that brings more benefit than harm. And I want to, because I have a little bit time to refer to, yes.
I'm grateful to my honourable friend for giving way. I'm just interested in the possibilities of AI helping with detection and speeding up that process, but also potentially freeing up resource to be able to direct further into greater earlier detection by focusing on on spending those resources on potential screenings for younger women. Because if we are going to harness the potential of AI, surely the first thing we should do is to be able to redirect the resources that are saved into making sure that we can save more lives, potentially those young women that have campaigned so strongly on this petition.
And yes, and saving more lives and freeing up resources is exactly what we should be doing. And as I say, the AJAX trial and other evidence that is being looked at will be happening within the next year. And so hopefully for yourself and others here today and the campaigners, if the evidence is strong enough, it will be looked at and things will change. I want to, I've got a number of other issues that colleagues raised that I want to touch on. The member for Wokingham, who is chair of the all-party group for breast cancer, he always reminds us that it isn't just women. There's 60,000 a year who still die from breast cancer, and a small proportion of that number will still be men, and it is always important that we remember that, and he's doing an amazing job as the chair of the all-party group. And he, if I'm here and the lady who speaks for the opposition here, the honourable gentleman is often here as well. So we become a regular trio in these debates, I find, on a Monday. Also, I must mention my honourable friend, the member for Mid Cheshire, who gave a very emotional speech about his constituent Sarah and her husband, partner, David. So tragic. And I want to thank him for sharing that and want him to know that, you know, for all of us here who heard that, that already was not in vain. I think, you know, he said he wanted to make sure that that had been heard, and how tragic and the consequences and long-lasting the effect of this awful disease is, not just on those who suffer, but the wider family. My honourable friend, the member for Portsmouth North, also asked me about cancer waiting times more broadly, and I can't let this moment go without stressing that cancer patients are now getting diagnosed in the shortest time on record. So I'm pleased to report that also. The honourable lady who speaks for the opposition raised the very important issue of women with physical disabilities. And the NHS, I know we've spoken about this before, and the NHS has an obligation to make appropriate accommodations for people with disabilities, as I know she's aware. And unfortunately, however, some mammography machines are not a good design for people in wheelchairs and those who cannot support their own torso. For women where mammography is not an option, a physical exam can still be offered, and where a GP is concerned about the findings, following a physical exam, a woman can be referred for further diagnostic tests. The NHS is talking with manufacturers about amending the designs of mammography machines, and NHS England is considering whether alternative testing tools could be used instead of mammogram in these specific circumstances. I can also reassure her that the workforce plan is still imminent, and nothing further to add on that one. And also, as she is aware, with regard to lobular breast cancer and the Moonshot project, as she is aware, in April earlier this year, myself and Lord Valance, the Minister for Science, Innovation, Research and Nuclear, alongside NIHR and MRC representatives, met with the Lobular Moonshot project team to discuss how best to progress research in this area. And following that meeting earlier this month, the scientific roundtable on lobular breast cancer was organised, and Lord Valance hosted the roundtable, and Professor Patrick Chinnery, Executive Chair of the MRC, chaired the discussion. The scientific roundtable considered the challenges and opportunities for progress in invasive lobular breast cancer research, and the NIHR is actively encouraging high-quality, ambitious research proposals on lobular breast cancer, having launched a highlight notice in late 2025. So we are hoping they will make an application for that. I cannot leave the House today, Mr Vickers, without stating one message as clearly as I can. If honourable members or any of your constituents are at any time worried about breast cancer symptoms, such as a lump, an area of thickened tissue in the breast, or any change in how your breasts look or feel, no matter what age they may be, please do not wait to be offered screening. Please contact your GP at any stage. Coming forward early, as we know, and as Gemma knows more than most of us can, and her friends, can make all the difference. And I just want to make sure that that message goes out loud and clear. Thank you.
Irene Campbell to wind up.
Thank you, Mr Vickers. It's been a privilege to open and close such an important debate. We have heard from many members and the Minister about how important early diagnosis and treatment is for breast cancer, and how key it is that we tackle this issue quickly and effectively. We've also heard about health inequalities and deprivation, and how this can impact on the take-up of screening opportunities, and we must do more to address this going forward. The NHS 10-year plan has committed to diagnosing 75% of cancers early by 2028, and the National Cancer Plan has 75% 5-year survival target for all cancers. This is an area which is very important to so many people across the UK, and we must do all we can as a government to improve recovery and survival from cancer, in particular the most common type of cancer in women. I would like to finish by thanking the petitioner Gemma Reeves again, and congratulate her for gathering over 106,000 signatures, which is a great achievement. I would also like to thank Lily Parsi, Sophie Conway and Lily Ewan from Copperfield, Neela Givert and Hannah Maber from Breast Cancer Now, Christina Vizintin and Ross Given-Wilson from the UK National Screening Committee, Professor Sasha Howell and Sarah Hindmarsh from Manchester University for meeting with me and my team before this debate. And finally, as always, I would like to thank the staff of the Petitions Committee, who work tirelessly every week to make sure these debates go ahead in such a smooth and effective way.
The question is that this House has considered E-petition 742179 relating to NHS breast screening. As many of that opinion say aye. Aye. To the contrary, no. I think the ayes have it. The ayes have it. Order, order. The sitting is adjourned.